Hi, my name is John Tuggle with the Tridoc, Cedar Park, Texas, and today we're going to do Myrtle Set 2. Dr. Nora is going to be our patient, and we're going to focus. This is basically two activities. We're going to do it in the quadruped position as well as standing. It's going to be pretty simple. So we're going to start with his right leg, and what you're going to do is you're going to draw little circles, and so what you want to do is you want to start drawing in a clockwise position. So you're going to take the right knee, he's going to bring it all the way around in a circle. And the big thing that we want to notate here is we want to keep this pelvis steady. We don't want this getting wild and out of control. Let's look at wild and out of control. So see how he's doing this? He's dropping here, he's bringing the pelvis all out, he's getting way too much motion. That's not what we're looking for. We want to do it again, we want to keep it stable like this. You're going to do this for 1 minute. Once you've done it for 1 minute, what you're going to do is you'll stop, you're going to turn around and go the opposite direction. Just like that. So he's got nice stability here within the pelvis, and we're going to do that for 1 minute. After he does it for 1 minute, we'll get standing up. And you can grab a hold of either the wall or something, a door frame, anything you would like. I'm going to do the exact same thing in a standing fashion. He's going to bring his knee up. We're going to use his right knee. And he's going to go out all the way back around, just opening up that hip. We're going to do this for 1 minute. Then we're going to turn around and we're going to go the opposite direction, in and all the way back around. Two activities. You're doing them laying down, you're in the kneeling position, and then you're going to do it standing up. You do both going clockwise and counterclockwise in both positions for 1 minute, and then you'll switch into the other side. And that concludes Myrtle Set 2.